And today we get to learn from Laura Ramos. And Laura has 35 plus years of experience treating orthopedic injuries and sports injuries in the professional arena, the Olympics, collegiate, high school, and amateur athletes. Laura, she actually trained under Dr. James Andrews. She trained with Kevin Wilk, a world-known physical therapist. She's worked on the women's professional tennis tour. She served as the head athletic trainer and strength coach for 22 seasons with the WNBA, Detroit Shock, New York Liberty, and the Las Vegas Aces. And she currently is the Detroit Medical Center director, PT, the resident of that program. She is, and I want to really say welcome, because she is now the director of the Winback Academy for North America and is going to really be helping us guide and expand what we do. So sit the way you would sit if you were excited, because I've asked Laura to share with us all the way all of us can improve our training so our gliders don't hit the trees as we're trying to land our patients. Laura, welcome.
Thanks so much, Jeff. Man, what a great intro. I really appreciate it. And resiliency, I love your thoughts on resiliency, because it is it, right? We think about it much differently. We'll talk about it much differently with our athletic population, but for sure that psychosocial piece of it is a huge part. And that's, I think, what we were just talking about there. And yeah, that's what we're going to look at today. We're going to look at load management and the science behind applying it in sport, how we're utilizing recovery, and maybe how we can incorporate Winback, specifically that, TECARTherapy, into our recovery programs to help build that resiliency of our athletes. So again, this is the information I'll be sharing today. I've utilized the Winback since 2020, starting to incorporate it into what we do in load management and recovery. And it's helped me out in the last 2 years, especially, or 4 years total, but winning back-to-back championships in the WNBA. When we're looking at our load management, the whole objective behind load management is it depends on who you are, whether number one is improving athletic performance and number two is injury prevention, or flipping those around. But those are definitely the top two. And then for us also as clinicians, we can use these data points that we're getting in load monitoring to help us better have objective measurements for return to play safely, and having the athlete feel comfortable with that return to play. So this whole load management, basically, when we look at it, it's what we're doing in our sports and our training, and it's balancing between these stimuli that we're getting in our games and in our competitions and in our training, and what we're doing on a recovery. And it seems simple, right? We think that that can be a simple process, and theoretically, get enough rest and give that body, after you do your training, it'll give an opportunity for it to repair and recover. And if you got that balanced cycle of going through and giving yourself this as stimuli and then getting enough rest, then you should start to surpass that initial stimuli. And that's where we get stronger, we get faster, we become better conditioned. And that seems relatively simple theoretically, but really on the flip side, it is difficult. It is complex, because if we don't get enough recovery, and we have too much training load, we compete too much, we train too hard, then we're going to have all of these negative components to it. We're going to get decreased performance, injuries are going to occur, the immune suppression, we saw that with the whole component of COVID, sleep disturbances are huge, and reduced mood. And then when we start to look at these in a big picture, that's when it's going to be a challenge for us to really balance these, because the complexity of it varies from sport to sport. A lot of the data and the information that I provide to you today, the studies, the meta-analysis that are based off of basketball, elite level basketball, and through soccer. but this applies across the spectrum in many many aspects. But even when you look sport to sport, individual players within those sport have big variances, and position to position, a guard in basketball versus a center, a defensive player in soccer versus offense, the keeper versus the runner, much different positions in soccer. So now we look at the difference in also males versus females, and we see again differences. So this is a complex situation that we're looking at, and there was a systematic review and looking at male basketball players, and one of the load monitors that's commonly looked at is sprint performance, and there was a 48 to 72 hour recovery time that it took for sprint performance. And then if they had that same load, that same game, that same component, the recovery time for jumping, for plyometric response, was 48 to 96 hours. So even within that same, there's differences in the parameters in what you're testing and looking at. So, what are these loads we're talking about? Well, when we look at load on the body, load on the athlete, we should break it up into these two main categories, and that's our external load and our internal load. And let's first break it down, and let's first look at our external load. So we're going to look at our external load. This is simply the total amount of work that you're doing as an athlete. This is both your competition, your games, and what you're doing in training. And again, as I just said, it's multifaceted. So it can be that game. It can be what you're doing on the court, on the field. It can be what you're doing to warm up for that game. It can be your actual resistance training that you're doing maybe after that game or on an off day. It can even be your rehab that you've got going on for an injury, or what you're doing for recovery if it's a dynamic type of recovery. All of that is part of your external load. And in looking at that external load, some of the common measures that we see are power output, speed. Big one is acceleration, deceleration time. So, and then your time motion analysis. These are all numbers that are picked up and are looked at, and then your body, your makeup, your external load. I call it your body map, because when we make for every one of our players a body map, and that body map is not just your range of motion and your postural position, it's your internal health. What does your blood work look like? What does your metabolic system look like? And then it's also, how does your body respond to load? What does your load profile look like? What do these numbers look like? And in today's world, because of all of our technologies now, we've got many different measurements that we get, many load measurements we can obtain through, whether it's telemetry, our GPS systems that are out there, the big ones, Connexon and Catapult, and even our other micro technologies, Vold in our force decks or our OptiTrack and movement. All of these, sometimes when it's first started, probably inundated us, or still does to some degree, with an enormous amount of data, to the point where you've got to hire people to basically assess and accumulate and spit these data points out. So we get an enormous amount of data, and we'll talk about what we need to possibly do with that data, or how we need to look at that a little closer as we move forward here. But think about the second piece is our internal load. And that internal load is the physiological and the psychological stress that person experiences, that athlete experiences in response to that external load. So in that game, they're going to get an external load. We're going to measure all that, how much load they got, how many accelerations, decelerations, what their speeds were. And they also then have how their body responds to that. And if you consider that physiological makeup of each athlete, it's super, super individualized. And therefore, you can do the exact same strength training program. Two athletes can go in, do the same number of reps, do the same amount of weight, and elicit completely different internal responses. So that internal response is super, super athlete to athlete basis, and will really, that's where you have to match, and you have to build this body map for each one of your players or each one of your athletes. So internal mode then, or internal monitoring, again, with all of our technologies out there, I mean, it's a massive, whether you're talking about, you know, even our recreational athletes, many of us, our little league, are now overtrained. If you look at the number of games that they play on a weekend, if it's a soccer tournament or a girls basketball tournament, or even a football, type of showcase tournament. So we have all these modes that we can individually look at, whether it be our Apple smartwatches. We used in the bubble a lot, and I know a lot of our players, we still utilize the Aura ring because it's shows a lot of the heart rate variability numbers. It does a great job with sleep patterns and looking at REM and deep sleep and how much sleep, and really analyzing your sleep and giving you data points on that sleep. And then of course Whoop Band. So there's all different types of technologies out there, and some of those, individual load monitors that are the internal load monitors that are real common that we look at are heart rate variability. Again, what's going on with our blood, lactate levels. We do a lot of like biomarkers within our blood work to look at those. And then, something that's relatively simple, not super technology based, but has been showed great efficacy and evidence based, is just rate of perceived exertion. Asking that athlete how they feel. It's been shown throughout the research to be a really accurate internal load variability or monitor to look at. And I think with the heart rate variability is really interesting that it became frontmost and forecasted during COVID, in that they started to see, people with low heart rate variability. Those are folks who are, struggling with their ability to adapt. They have problems with their cognition. There's that fight or flight type of scenario, as opposed to that high heart rate variability. Those are people that are really adapting well and don't have that fatigue level. So we were utilizing that as even signs or symptoms of your immune system showing some problems. So as an overall statement, though, if you look at, there was a big study with soccer, and it looked at thousands and thousands of different programs and athletes and how they were load monitoring. And there's so much variability and so many different things out there, but unanimously it's believed, number one, is that you have to have an integrated approach. You really have to be vigorous in looking at it and applying what's pertinent to your sport, to your athlete. Sometimes it's even individuality to that athlete within your sports team. And it's got to be consistent. So many times they will see that in a season, somebody will get a new flavor of the month, or it'll be the new vibe. And so they'll put it into their program and say, oh, we're not doing that, but they are. And that inconsistency really can be key to success or non-success. So I think I tell people a lot of times, do your due diligence ahead of time, make those decisions going into a season, but stick by those decisions through the season as tight as you can, so you can have that consistency. And then if you need to, at the end for the next year or for the recovery in the off season, make those pivots then. And then you've got to combine both of these. You've got to combine what that external load is and collect those numbers, and what that internal load is and collect those numbers, because the more information you have about those stress factors and how they intermingle with each other, or they're completely related to each other, whether you're talking about soccer or basketball players or tennis players, recreational level athletes versus elite level athletes, you don't want to just sit there and isolate yourself on one data point. You've got to figure out, what are those pertinent data points, and use that integration. And also recognize that in the beginning, and I think a lot of us still do, we get overwhelmed with it. So simplify it also. Find out those and report, what is important. Realize what's important and focus on those few key important metrics, and don't get overwhelmed with analyzation of numbers and statistics that really are not pertinent, or you haven't proven that they're pertinent. All right, so again, when we're looking at these load numbers, what I really want to to make sure is that as an individual approach to this. Oops, let me go back here. Hit the wrong button there. Oh, really hit the wrong button. Okay, great. As an individual approach to this, let me get myself back where I'm supposed to be here. We've got to integrate both those internal and external load monitoring and identify what that athlete's resilience is. Because we can, again, as I talked about before, you can put somebody under the same stress, and if they show this lower internal load, so they've got great heart rate variability, they have great blood levels when we look at their biomarkers or we look at their saliva, studies, they've got all those great biomarkers, and we're putting them as this resilient, fit athlete, as opposed to someone else who's on that other end of that spectrum. Build that map for them, and then understand that is our goal, right? As Jeff said in the very, very beginning of this, it's about that resiliency. And so we want to, number one, our role is not just to rest these athletes. And I think that's where, especially in the NBA, there's been, a lot of concern and talk about the amount of rest or players taking time off based off all this, all of the metrics that have now come out with our GPS and our load monitoring systems. And I will go to bat every day because our WNBA season, over the 22 years I've been in it, or 29 years has existed, I've seen our schedule increase 12 games in the same amount of time. So now that the women are up to 40 games in a WNBA season. So that I will always go to bat for. Those extra games, that extra load in the same amount of time is difficult. At the same time, I can't change that. Go to bat, we try to, and we talk about schedules and travel and all those pieces, but we can't just rest our athletes. So our job is to figure out how we build that resiliency and have them recover without that rest piece of the puzzle. And that's what we're going to talk about next. But Dana, what I'd love to do is see if there's any questions in the chat, and then also get some feedback from the panel with regards to their ideas with load management.
Right. And Laura, I don't see anything in the chat currently. Let me look again here. But certainly, Jeff, if you want to take a lead there, or anyone that's in our panel group.
Laura, I'm curious. Last week, I had the opportunity to do a lactate test. And it was a simple, low blood finger prick, on the blot. And they had me do 2 minutes of jump rope, which wasn't easy, right? Because it's something I hadn't done in a long time. And then get tested, and then, saw that I was pretty average. So how often were you testing? And then what's your secret sauce to, improve that? What's your recommendation?
Yeah, so number one, it just depends on what those internal markers are for you. With our blood markers, we typically aren't using those. And that, like I said, I think I saw that I had a picture of one of those right on the monitor there, and then you just went through it. So it's really simple to do. So with that, on an average perspective, when we're doing those little pricks, you can do those we do them more as not a regular. It's based off of some of our athletes that we're seeing other areas or categories. Some of the, maybe I want to say even that blood prick is invasive. That's not as invasive. So then we'll look at them a little bit closer. But other than that, we're looking at a lot of our sleep patterns. We're looking at a lot of our heart rate variability and resting heart rate, all those pieces of the puzzle also. And but those are looked at on a daily basis. What's our answer? It's going to come up next in the presentation. It's recovery.
Right.
But great question. I'm glad that you saw that and experienced.
Do you have a favorite tracker that you've seen, over the years? That's, I think most people say, oh, Aura is fantastic for our sleep, for that kind of data. Whoop is great for the athlete. It gives us that type of data. Some people use both. Do you have a favorite one, or see any new ones coming down the pike?
Yeah, so I love both of those products. A lot of it's what the players will want to use, because the other piece that's interesting for professional athletes is, number one, is we can't track in the WNBA. We can't do any external load tracking during a game. So any of our Connexon and the GPS can't be done during a game. It's not allowed by our league. And then even our internal load and our external load monitoring outside of games and practices, workouts, they're wearing it on their own at home. Sleep is all completely voluntary. And then they have to be willing to share their data with us. So our athletes, typically it's not that big of a deal, but that is, for us, it is voluntary. So I love those two items. A lot of our players use that. There's another piece out there that looks at breath analysis too, that I've been playing with and looking at, called PNOE. And what we're getting from that, but I love just the simple blood test too, the Pinprick.
Okay. Thanks. I appreciate it.
Yeah.
Anybody else on the team have a
Laura,
question?
I just want to talk to you a little bit about Don DeFabio's sleep and looking at recovery and sleep. Back in the day, the simple line was, if you're losing 10% of sleep on a regular basis, you're prone for overtraining or overtraining. What kind of biomarkers are you looking for with your Oura Ring? And, are they just activity trackers? Are you looking for respiration? Are you looking for heart rate? What are you looking for with sleep to quantify quality versus quantity?
Yeah, that's a great question. And that is a huge factor. And I'll share a little bit with you. We got to dive really deep into the bubble, allowed us to dive deep into a lot of these because we had complete control, which was like doing a TED, right? Having a standardized controlled study, because our players weren't off on their own and doing things. We're all there in the bubble for that 96 days. And we all got Oura Rings. And during that time frame, so that Oura Ring, what that Oura Ring does is, when it's not only picks up your number of hours sleep, but it literally is looking at the number or time, if it's minutes even, that you are in deep sleep versus REM versus light sleep. So it's looking at your pattern, not just how much sleep, but what type of sleep you're getting. And it was interesting during that time frame, I started using a device at that for the help with brainwave and just putting it on, and it had the audio piece of it and kind of a light piece of it to help, the alpha versus the beta brainwaves, especially when we would finish, you finish a game at 11 o'clock at night or 10 o'clock at night, and you're amped up, and then you got to go to sleep and be ready for maybe a 5 a.m. bus or a practice at 9 a.m. It's tough to turn all of that down. And so, we played with, we literally can see, some differences when you start to utilize different techniques like that, different pieces of equipment like that to help with your sleep. And literally an athlete that went from only 28 minutes a night of deep sleep to using it once with that sound, in that delta wave, where she literally that night got 2 hours of deep sleep.
That's great. I think that I prioritize.
Oh, that was called the brain tap. I don't know if everybody's used the brain tap before.
Sure.
Yes. Yeah, brain tap, Mendy. There's so many
Yeah.
out there now that are really great. But I prioritize sleep above everything else. When I'm dealing with patients that are in acute pain or the chronic pain patients, and I really try to strive for 7 to 9 hours a night for them. And I think one of the best pieces of advice that I've given over the last couple of years to patients in that regard, Laura, is stop eating anything 3 hours before bed, right? Otherwise, if you do it later, you're busy digesting during your sleep instead of, resting. And that's what's interfering with the heart rate variability, is one of the things that we notice.
And that's another great point. I tell athletes all the time, I said, do you know how many, because I know the two numbers for sure. Serena Williams, when she was at her peak, averaged 9 hours. That was usually where she was sitting at, was at least 9 hours of sleep a night.
Beautiful.
LeBron James talks about like 11 to 12 hours a night. So
that's great.
It's huge.
Any other questions from anybody? And please feel free to put it in the chat or put your hand up and we can actually call on you.
Yeah, no, that's great. This is great, great info. I'm gonna have to go back. There we go. We'll move along, and we'll have time at the end too to go through. So again, so what's the answer, is to build that resiliency is a recovery program. And we know, again, it's multi-systematic, just like, our whole load management was multi-systematic. So you've got to incorporate strategies then that balance the physiological system of the human body, but also that psychosocial part, that emotional part, the behavioral, that intensity of that competition. All of this is part of, your recovery program and your strategy. So again, we'll divide this just like we divided the load management into 2 different categories. We're going to divide the whole recovery into a passive and an active method. And each of these both, will address regenerative of that physiological aspect. So those, that cellular component, and the psychological component of a recovery, that mental and emotional stress that go along with competing. So this is the pyramid. I'm so it's right in line with what we just spoke about, right? This is from the National Strength Conditioning Academy and their recovery pyramid, and sleep and downtime right there, number 1. And again, that's that quality of sleep, the routine, the mental recovery, relaxation. So this is, where your sports psychologists come into play with our team also. And then next one up is that nutrition and hydration. And so again, working with your nutritionist to understand, what your nutritional needs are, and then us knowing what those biomarkers are and what your blood work is to make sure that you're getting the correct type of supplementation if you're not getting enough through your diet. And then, of course, there's your category of your cold tubs. That's what I just had up there earlier, was your different contrasts and your cold immersions and plunges. But what I really want us to focus on in the next 15, 20 minutes here is our EMS piece of it, but our massage, and then our active recovery, including maybe some stretching. And I think that number 1 is a great recovery program isn't just simply passive rest. That I'll use Newton's law of motion, just kind of tweak it a little bit. And, anybody at rest is going to remain at rest unless it's acted upon about. So if we just rest, we're not going to be ready for that next competition. We have to exert, we have to do something externally to our bodies to help facilitate that recovery, to help facilitate our resiliency. And so one of the big pieces of the puzzle on that top of that pyramid that shows efficacy, that shows it's been validated through research, is sports massage. And what I'm going to say to you is, if we're doing sports massage, why not with Winback? Why not with TECARTherapy? Because I use the analogy of blood flow restriction training. If you've got somebody who is either, because they're in season, they've got an injury, they're post-surgical, whatever it may be, the only type of resistance training that they can do on that day or that during that session is light resistance training, then why not BFR? Use BFR. Because if you compare the two, BFR and light resistance training versus light resistance training by itself, BFR wins every time. I say the same with massage and Winback. If you're going to do a sports massage, use Winback, because if you do Winback at the same time, it's going to be the winner every time because of the physiological and metabolic differences and changes that we're going to get. So we know that sports massage, where it combines a bunch of different types of, when we're talking about traditional sports massage, whether it's Swedish and deep tissue, myofascial release, trigger point components, along with stretching or mobilization. And each one of these has their own kind of specialty, but it's all involved in the sport massage. That somebody gets a recovery massage, whether it be improving circulation, reducing that muscle tension, and overall relaxation. A lot of times you get, if we're working on that deeper tissue, we may have to focus on more trigger points and spasm to improve range of motion. Or if we're just working, simply through that fascial system and looking at the imbalances and getting that, our gel-like substance moving better, all of these pieces are part of our massage. And if you think about it, and you're looking at those areas of improvement, it falls right hand in hand with TECAR, with our transfer of this, our electric, both capacitative and resistive. And so if you're doing a sport massage and you add in Winback or TECAR, from an RET and CET perspective, just to start out with, you've got a great effect analgesically, number one, because we know that right off the get-go, that current is going to affect those nociceptors and it responds to that high electric frequency. And it's short of saying gate theory, but it does block the modified idea of the gate theory. And then you have, of course, the diathermic effect, that you've got that heating and that pressure is going to help reduce the pressure, the tension on the tissue, whether it's the fascial system that's constricting or putting pressure on those nociceptors and creating pain, or spasms or trigger points. And of course, you've got that metabolic stimulation, which again is going to increase that flow and continue to produce that longer lasting pain relief. So as you're doing your massage, you're going to get that physiological assistance from the TECARTherapy for that analgesic effect. And then we know that there's an enormous effect on the fascial system, again with the TECAR, from knowing that fascia, number one, we think of it as this web and this structure, but it's fluid, right? It's hyaluronic acid and it's fluid and it's gel-like. And that viscosity has been shown with the heat, that temperature differentiation just leads to that molecular weight just decreasing and having a much more flowing hyaluronic acid throughout that. So relaxation of that, or movement and that viscosity of that whole fascial system, will allow the muscles then to be able to slide and glide upon each other. So those pieces just in themselves, from a massage perspective, we look at those two, just makes so much sense to add the your TECAR into your sports recovery. So what I'll say to start out with is, if you're just doing a typical sports recovery massage on an athlete, then an example would be using just your CET. You can put your fixed plate right underneath their abdomen if you're working their posterior chain. And then now with the new back 3TX and the 4, using our handle, we can typically go at a little higher, a CET for some warmth at that 50%, and spend our 4 or 5 minutes on that posterior chain and then the anterior chain to begin with. And then how we would progress that is we can dive a little bit deeper, and this is going to maybe answer the question of which one. It depends for me on what you're trying to do, if you're doing CET or RET first. But typically in this situation, we're just starting out with this general flush with our proximal muscles first, and then go into our distal. And then we're diving into the RET. And with the new technology, we can utilize at the same time TENS, and for pain relief, and also the high TENS. And the high TENS is, again, electromuscle stimulation that you can utilize while you got the heat. Now the TENS is being driven in deeper, so it's not just superficial on the skin. You're going to feel it deeper in the nociceptor, so more pain reduction. And then also that focal, that high EMS, when you find a trigger point, you're able to not only you've got to release it with the heat, but you also now have EMS that's going to be able to go deep, because we're using RET and we've got it set up. You can see so it's going through the back plates on the opposite side. So we can work on those trigger points and do mobilization at the same time, because you're affecting that joint capsule. So, I mean, just what a wonderful addition to what your hands are already doing, now even further physiologically within the connective tissue of that athlete. And then you can finish it completely if you want to, then with the bracelets, if you prefer just to have your hands and not use the handle, and prefer just to have your hands. So, again, amazing what Winback has with the bracelets, in which the energy is going to be transferred through your hands to the patient. So all of your touch and your massage doesn't change. You're still using your hands the exact same way. But in this case, you've got that RET energy, that high energy going through the bracelets into the body. And again, we can go through that entire chain. So we can put your return plate either up on the abdomen or up on the back, and then have that entire energy going for as you work from your proximal end towards your distal and then flush back up. So that's number one, is just with your recovery massages. If you're doing them, try it with Winback, with TECAR, and see what the result differences are. I'm another huge user of lymphatic massage for recovery, because again, that lymph system is huge, or if whether it's for an injury, to reduce swelling. And we know that the lymphatic system has three pieces that really work. That the lymphatic piece, but there's also the muscle pump and then the heat component. And now with TECAR, you can affect all of those, because we can start out with just opening up the whole lymphatic system. And we typically will do this with a CT and get it warm, 70%. If they can't tolerate 70, then I'll dump it down. But we're going to go through the 4 areas. We're going to start proximal and works distal, because most time what we're working with is that, the lower extremity. So my technique for this is to get into the abdominal and open up and just basically do CET. The plate is on their back, and I'm going to go with my circles here for 10 seconds with deep CET. It's great with the new handle, because all you have to do is click it with your thumb, and you can decrease that to 10%. And I'll do another 10 circles in the opposite direction. And I'll do that 3 times. So I'll spend a minute on the abdominal lymphatic drainage. Then I'll go to inguinal, do the exact same thing. Go to popliteal, and then go to the foot. Now I've opened up every one of those channels, and I'm going to follow that up to open up and move all that fluid, get that lymphatic system into our center and our body can get rid of it through using my bracelets. And so then you can just put your bracelets on that RET, and then just your lymphatic. We're not going to change anything that you're doing as a massage therapist or as a manual therapist. Do your normal lymphatic drainage technique at that point. And then to add into it now with the new technology, we can add in a drain component to it. So we talked about, you have the heat, which we already talked in the lymphatic, your massage. Now you actually have the third component available with the new 3-back TX. And the 4 is that we can add stim, and specifically drainage stim, the pulsing of the stim to facilitate drainage. So if I'm working, for example, on the picture here, I'm working on that posterior chain and that lymphatic drainage. I've got the plate on the abdominal area, and I'm working through this posterior side. I've got the RET set at 30%. So I've got some heat going in there. And then I set the high EMS and I put it on drain, and I'm doing my same lymphatic massage, but now I've got that pulse to help the lymphatic system muscularly pump out, in addition to the heat in my hands. Just a great combination. So I think before we dive into the active recovery piece of it, I'm just going to go ahead and open it up to a couple questions if we have any in the chat. Otherwise, we'll move on to the active recovery.
There is a question, and it's from Patrick Igloff. Patrick, why don't you go ahead and unmute, and you can ask the question if you'd like. Go ahead and unmute, Patrick. I don't think you did unmute yet. I can read it for you. He has a question. He has a question regarding a 4-month post-surgical ACL reconstruction, patella tendon. The patient still has medial subpatellar pain with knee extension exercises. What are some of the protocols to activate the quad as well as reduce the pain at the surgical site?
And that's specifically related to TECAR?
It doesn't say, but
yes,
Patrick,
I guess
you can
unmute. I guess I'll relate it with the TECAR piece of the puzzle here, because then we can, and if this doesn't answer it, we can always at the end, Dana will have information that he can follow up with me individually on it. But one of the things that I've utilized, so it's 4 months post-op, so that knee extensor leg, whether that's being in that pain, whether it's being caused by arthrogenic muscle inhibition, that pain cycle at that point it's got to be some somatosensory already, that pain piece of the puzzle. And so for me, I'm going to start out with utilizing, you can try definitely BFR if you haven't done BFR before, because we know that can help recruit it not only from a pain perspective, but it can also help from a arthropathic muscle inhibition. And so just incorporating it into what you're already doing with some of your other exercises. A lot of times I'll do, if it's pain related, I'll put them on an isometric quad contraction, pain hold for 45 seconds with that BFR on. So that's one way through BFR. With the Winback, I will go through and do what we just spoke about, just get the lymphatic system opened up, because a lot of times it's just a lot of our for no better terminology right now, a lot of junk sitting in our system, whether that be from the surgery and all the anesthesia. I mean, this stuff is just toxic to our bodies and healing, and people respond differently to it. It's another one of those internal pieces. So just to open up their lymphatic system and to try to open up and clear all of that out to begin with, not just think about the knee, just think about their overall health. And then you can now, with the high tens piece of it, you can get in and start to work through that area with the tens on, or with that high EMS on, also the tens for the pain and then the high EMS for the muscle contraction, and have them working on quadriceps contraction, or have them working on range of motion. You can put the Winback plates around, or the sticky pads around, if they're on a bike for range of motion. You're unlimited in what you can do.
I love the way that you showed, the portals for the lymph as the most important points. And this is such a big discussion that we could go on and on, but I have to share with you what I've been doing lately, because it's been so useful. I'm using the 6D tape, which has the tabs already on it. So I'm wearing it right here on my subclavian area, right? And I agitate it for a minute every couple of hours, rotate left, right, up, down, and I'm pumping these areas to move that lymph flow along. So it's a nice adjunct to the Winback and using the EMS. And it really is changing some of the outcomes, especially on some of the post-surgical cases, that I can leave this on them. And now they're actively participating, in doing it when they're out of the office as well, helping to drain that lymph. So really great conversation on the lymphatics. Thanks for doing that. And the importance.
Oh, fantastic. That's great input.
And I have one more question for you on hydration. Like, that's a big issue. I measure hydration on my patients. Sometimes I'm having a hard time getting water intracellularly. Any tips that you've been using for the athletes, or that you see, going around the courts, that's really helping hydration?
Man, I wish I could have a great answer for you on that, Flippa, just because the nutrition side isn't my quote expertise side of it. We push hydration, we push water, we push, our electrolytes piece of it. But I'm going to have to defer that one to any other, nutritionist specialist on that end of it.
Okay, thanks. I don't see any other questions right now. There was one. If you want to handle this one now, it's, with the tracking devices, do you see an increase in anxiety with the athlete?
Yeah, that's a great question. And the answer to that is yes, depending on the athlete, because it goes back to, that's where sometimes these are not the best things for these athletes, right? Because you have to look at that psychological piece of it. They get more tense knowing the data, knowing the information, or worried about, oh my gosh, it's affecting me, or the coach is going to look at this. So that's where, again, all of this data information, you really have to look at this on an individual basis when you're setting these programs up, because it can be a greater stress than the sport. That's a great point. Great question. So that's, again, we can't mandate it either. But if it is there, that's where some of the, our sports psychologists will help us out. This might help out a little bit, this protocol, for that ACL question also, just to kind of think you through. So you saw in our pyramid before that it not only is that passive piece, but it's the active piece. And so we talked about the passive was more of what we've been going through with regards to the cold tubs and the massage. But from an active, one of the things that we've utilized is a light, bicycle flush right after your workout, whether it be a strength training workout or right after a game. And what the whole idea is that with that flush, you that blood flow is critical, right? For that oxygen and those nutrients in that affected area. And that's where the bicycle riding comes in, to increase that blood flow. So that pedaling motion, can speed up and create basically a muscle pump for the body. The key, most of the studies look at this, is you got to have like a 60% heart rate when you're doing it. Can't just be a ride in the park. It's not, so it's not a hard pull-down workout, but you've got to be working. You got to, keep your heart rate. And then it has to be a light resistance, 80, 90 repetitions, per minute, enough to keep that RPM at that level, your heart rate at that level. And it lasts anywhere from 15 to 20 minutes. That's your typical, kind of flush program that most people, in rehab will look at. Well, think about what we just talked about, and then let's talk about those biological effects of TECAR then. So we know that that's one of the huge effects that happens no matter what. Even if we don't have the intensity up, we got it at 10 or 20%, where we're not creating a diathermic effect. We always have a cellular effect, a metabolic effect. We always have this ion exchange. And if you look at, the hydrogen, and that what we're trying to push out of the system, that lactate with this whole bicycle, this is right in TECAR's wheelhouse. So another, therapeutic effect that we know is just that whole circulation. If we use heat with it, we cause that vaso movement, and whether we're using 30 or 40 or 50%, we can have this blood and lymphatic circulation increase. So again, right in the wheelhouse of what we want from recovery. So if we take that exact same athlete who was just going to go and do a light bicycle recovery workout, do those same parameters, but now go ahead and put our TECAR on. So put your sticky pad for your return plate. Most of the time we'll put, if you want to focus on the anterior chain, put it on the abdomen and across the quads. If you want to focus on their posterior chain, put it on their low back and put the RET on their hamstrings. So whichever you want, or you can put it even lower. You can go on to the gastrocnemius if you want to go through the entire lower extremity chain, but do the exact same thing, just with the TECAR on. Again, nice, lace, if you want to put it on low or just medium with a nice soft heat, just a 30, 40%. You probably find they don't have to be on the bike as long. They're still going to be able to keep that sweat going, and they'll get that same therapeutic effect of that muscle pump. So that's, like I said, I think you can do that same thing for your ACL patient and put it on just that one leg. And again, whether it be on the abdominal, if you're doing anterior chain, it sounds like it's more quadriceps. It usually is more quadriceps driven. Put that on, or you can put it on a sandwich where you put the RET on one side of the knee, where they're symptomatic, and then the return on the other, and then have them do their bicycle range of motion with that Winback on for that pain reduction, circulation. So you got the analgesic, you got the circulation, the metabolic changes, all included in that. One last thing with regards to what I'll specifically go over tonight is something that's unique to pro sports, and I think it's probably happening more and more in college now, and we see it in the WNBA, the NBA, is post-game resistance training. Because with our schedules, they keep adding games to, especially NBA, Major League Baseball, hockey. You may play on a Monday, have the off day on Tuesday if you're at home, if you're lucky, or travel to the next city you're playing in on Wednesday, and then do the same thing Thursday and Friday. So where in that week do you strength train? There's no time. What we typically used to do was do it on your day off that you were traveling or when you got into the city, but then you never really have a recovery day. So what the tendency has now moved towards is to take and utilize that, go work out post game. That's when your resistance, because otherwise, how do we maintain, or how do we gain? Most of the time we're maintaining the strength and that endurance that we came into, and that power we came to the league with, or into that season with. So all we're going to do then is add to our workload of the game day with a resistance training load. And then we've got the next day, actually literally then, as a complete recovery day. But what you really have to do is look at each one of those players and what that post-game day workout looks like, right? Because you might have a player that just played 38 out of 40 minutes, and then you got another one that just played 20. So what is their external load? And even during that time, what was their acceleration, deceleration, position, what does their individual look like, and then put their post-game workout into that. Now, what I'm going to propose is that why don't we add Winback to that post-game workout? Because now it can actually become a workout that improves strength and resiliency, those pieces that we need, but we're adding Winback into it. So we've got neurostimulation. We can help with pain management while they're doing their actual training. We can help out with circulatory. We can add that stim to it, and maybe even pull in muscles that we'll talk about this that might not be working because as you're fatigued, what do? You use maybe a poor movement pattern, and we're doing corrective exercises, but maybe they're using the wrong muscle groups, and maybe we can facilitate the deep muscles with our stim to correctly work. And of course, we can have that metabolic action. So this is the extreme of, but we can look at, in a workout, like we just saw Steph Curry doing some lunge stuff. We could set, Steph up with the abdominal and quadriceps on, or in this case, we've got, the return plate on the back, and we're doing posterior chain work. So we've got our RET on both sides. And, again, it's just a quick video of just think about, you can do anything with this. I can do core work, and I can have it through my abdominals and my glutes while they're doing their core work. You can do, any of your workout, whether it be lower extremity, core, upper extremity. Put my bracelets on, have the other return plate on the abdominal area, and I've got that whole TECAR energy going through the body for that to facilitate the workout, but then at the same time to be able to actually make it a recovery component too. So, you think about this athlete's doing their workout after a game. So you're going to be fatigued. So what do muscles do when they're fatigued? They revert to maybe a poor movement pattern. So you've got an athlete that you're working on correctives. If you put this RET and this high EMS on at the same time, and maybe we can start out with the radial, like that's where that was kind of, we just saw it was set up with that posterior chain where it's just given that RET through that whole posterior chain from that guy's back all the way through his, hamstrings and his calf muscles. Or we could set it up so it's working deep focally. And so I can put it on his abdominals. I can put it right on both of his glutes. So if I want to make sure his glutes are firing, that he's not cheating that lunge or he's not cheating that squat using more hamstrings because that's their movement pattern, I can put that stim on at the same time they're doing and recruit those deep muscles that he may not want to be recruiting because he's fatigued and he's going back to his poor movement pattern. So, I just am throwing out to you guys to think about utilizing this as in during those workouts. That isn't necessarily recovery because that's when, but it all adds to that resiliency of that athlete. Let's see, how are we doing on time here? We're just about done here. So then the last thing, again, is just that whole lymphatic. I'm just huge in the lymphatic system and utilizing it for recovery. And, it's huge in skin problem. If we can affect the biggest organ in the body, it doesn't matter. I mean, this makes sense. Sleep, fatigue, arthritis, that's all us in the wheelhouse of sport. But just don't forget that our skin is our biggest, organ of the body. And so if I can take and put somebody through a lymphatic workout, a flush post game, which we will often do, and we can take that and again put an RET on there, with some heat, and then I can go in there and put some EMS in there and this drain, and I can put that plate over in different areas on the stomach and then on the gastric of the sticky pads. And there, in this case, I can go ahead and put it on the abdominal area. And if they're small enough, I can use the bracelets. So I've got this RET energy going through their whole body. And then I can, put them through our 12-minute lymphatic drainage routine, which will start out with breathing techniques and then work on motion through the hips. And then we'll go up into, further motion with your legs and movement patterns of circles and then single leg circles. So it's that whole lymphatic active drainage. Why not do that whole program with our, with our RET and our drainage on at the same time that you're doing one of your lymphatic drainage active movement patterns for that recovery, because this is what's going to build that resiliency. So I guess my challenge to everybody tonight is, if you're using load monitoring and you're analyzing your athletes and creating these body maps of what their external loads are like and their internal loads and how much load that is before their bodies give up, and you're doing recovery programs, which I think most of us are doing, think about some of the ideas I just threw out there and do a little bit of experimentation on your own to see if you incorporate TECAR into your massage, into some of your post-recovery active lymphatic workouts, your bicycles, and your overall strength training programs. Can you improve your resiliency? Meaning that, can that player play more minutes, train harder, and have less tendinopathy, have, better sleep patterns, all the things that are coming up on your internal monitoring.